everyone, I'm Michael Abadi and welcome to Vermont Senate Spotlight. We are quite pleased to have Jane Kitchel here today. She's a Democrat from Caledonia County, which would have been unheard of years ago, but she's also the chair of the Senate Appropriations Committee and is quite busy right now putting finishing touches on the budget for 2015.
That's correct.
The governor rolled out his proposed budget in January. The House passed a budget, H.885, pretty recently, early mid-April?
It was about 3 weeks ago, 2 or 3 weeks ago.
Okay, and now the ball is in your court. And the governor has written a letter to you, kind of a rebuttal or a critique of the House's budget, saying maybe you ought to change it this way or that way, back more to my proposed budget. And I imagine that is the common course. So what are the differences there? What do you have to reconcile between the House and the governor?
First, the budget as it now exists is in the hole $1.2 million because of those corrections. So the first thing we've got to do is how are we going to address that? Second of all, there are a couple of areas that are really very high priorities for the Senate, and that gets into the provider reimbursement under our health care programs. And last year, we put ourselves down a multi-year track to make those reimbursements more aligned with Medicare. And it contributes to something the public's been concerned about, and that's the cost shift between the state-funded programs and insurers, and ultimately in people's premiums. So I think a priority for my committee is to see if we could come back to the 2% increase in provider reimbursement.
Got it.
The other big area of where we have public hearings, and there's tremendous need for housing and affordable housing, quality housing. And there is an entity called the Vermont Housing Conservation Board, VHCB, and the House reduced the level of funding from what the governor proposed, and I think we're trying to do as much as we can to address housing, and so that's another priority. Within the budget itself, particularly as you're getting to the end of the session, it's a must-pass bill, and therefore there's always something that needs to be taken care of, and so before we get done, you feel like you're not only do we have the budget, which we call the big bill, but included in the budget are many what would be maybe separate bills that would have moved forward but end up just being folded in.
Right, they're moving along on their own as you're trying to figure out the budget. The issue is emerging so late that the budget is the most logical place to deal with it. And an example, after the House passed the budget, there was an agreement negotiated on how we were going to deal with the healthcare costs for retired teachers, because we have not been funding that separately. We've just been paying those costs out of the pension fund. And those costs, when that practice started, were very small, and they have grown tremendously. Sure.
And it means that there's not the money in the pension fund to support both. So,
and there's a big bubble of teachers getting ready to retire.
Absolutely.
As well.
So the budget that we're going to be taking to the floor next week will have the provisions around how we're around the settlement or the agreement in terms of how we're going to fund that, which gets into authorization for inter-fund borrowing. It gets into how we're going to use any year-end surplus. So that's an example of something that got negotiated very much toward the end of the session. The same would be true with our with that enterprise fund that the governor announced and leadership announced, to have some flexible funding to work with companies that might be acquired or leaving, so that we can try to make Vermont an attractive place if a new company who might procure it, and IBM is obviously the prime example of that.
Okay, so that's a lot. Let me see if I can come back around. The House said no thanks to the 14 million health claims assessment fee. I think the governor did not call it a tax. And did they cut in order? How did they deal with saying no to that revenue? Did they cut, or did they just let a little deficit ride? Or
no, we do not have a deficit. We are actually, that's interesting because Vermont's the only state that doesn't have a constitutional requirement for a balanced budget. But
we have balanced budgets.
But we have balanced budgets.
Right.
Maybe it's our, just our ethic.
Are we the only? I didn't realize. I thought it might be maybe in the 20s.
And so what you
30s.
find is states that have that requirement, they go through all kinds of machinations to take expenditures offline. They roll them over into fiscal years. So it's kind of interesting, how they, the contortions that they go through to get to technically a balanced budget.
Because they have to meet a constitutional requirement.
That's right.
There's no getting around that.
So we take pride in the fact that we do it as a matter of course.
Right.
And we think we place high priority. The House did do reductions. There was money coming in under a settlement that came in earlier, so some things could be funded this particular year and not have to be dealt with in the 15 budget. And they did raise a small amount of revenues to close that gap, and they chose including snuff under the tobacco tax, which it hasn't been.
Okay.
And then they had they included e-cigarettes, which has proven to be very controversial because some people say that in fact e-cigarettes are important to help people stop smoking. Other people are saying absolutely they have tremendous health risks, et cetera.
Nicotine delivery system.
So that's right. Yeah. So there's controversy around that particular proposal that was passed in the House. I don't know what at this point our Senate Finance Committee is going to have to figure out the revenues that are necessary to support
their headache,
them.
right?
So I think we're going to be. We are, the House did only 0.75% increase on the provider tax. There may be other revenues that are very much related to health care.
As opposed to 2, you said?
As opposed to 2.
Okay.
So I think in the end we're going to say we really do need to support our health care programs and that the revenues can be identified that are very much healthcare related, but not the claims assessment.
Got it. You mentioned, and it's kind of fascinating, that the House has passed its budget, but it's such a moving target that there's already a $1.2 million shortfall from what the House passed. Is that revenue not coming in at the rate anticipated, or what's going on there? State accountants are always looking at where the numbers are.
Well, you can imagine when you're building a budget of over $5 billion, you're having to do a lot of estimates, and we have to do caseload estimates, how many people we think will enroll. So it is a very complicated process, and that's why we have a budget adjustment, frankly, in the middle of the year, because that's where we true things up.
Okay.
But in this particular case, there were a couple of areas. One was a correction and an update on the homeowner's rebate, and that was the biggest piece of the 1.2. And then we had to refine our estimated federal revenues that would be generated by a new population of Medicaid-eligible adults. And those were the two big pieces of the 1.2.
Okay.
And it's something that we would expect. Sometimes it works the other way. It might be on the plus side. In this case, it just happened to be on the minus side.
So with the feds increased Medicaid eligibility, and they've attached that they would cover 90% for a little while, for a couple, 3 years?
Oh, Medicaid is horribly complicated because it comes with a variety of match rates. And for example, we have a certain group of children have a different match rate. There are There was money that came in to provide a greater reimbursement to primary care physicians. So Medicaid has just a lot of different permutations. The other thing about Medicaid is the federal match, just for the general program, is based on a state's per capita income relative to other states. And so even if you didn't spend $1 more, that federal participation could go down, which is happened to us this year and last year and probably happen again next year. So even if you didn't spend a dime more, the state share goes up because our per capita income is rising, which is good
relative
news.
To other states.
Yes. So that's the good news. The bad news is the state has to pick up more of the cost of the Medicaid eligible services.
And that may be related to our low unemployment
That's
rate.
true. Yeah.
Okay, but we
But
get
that-
a little punished for it,
Yeah.
though.
So I think that was like $15 million that had to be put in simply because of the change in the federal match rate.
Okay. So that's a lot of moving parts, and not only do you have to deal with all those complexities, but there's been, the governor's taken a swing at it, and now the House has taken a swing at it. So there's already been sort of two iterations of it, and how do you approach, that seems like a very difficult job, and it's the end of the session.
That's part of being on Senate Appropriations, there's no question. There's a lot of complexity, and at the end of the session, many things come in that have to be dealt with, and they ultimately, the budget is the means to deal with them, as I mentioned before, the health care for teachers' retirement or the enterprise fund to other bills that might come forward. So we actually have to sort out and understand the workings of all of state government. Now that is, to me, that's one of the most rewarding things, to see how everything comes together. There's no question that there are a couple of areas of spending that represent the biggest chunks of the budget. And the biggest number one is our K through 12 spending. Mm-hmm. That's the number one. Healthcare programs, which are very broad because they include everything from our new hospital for the treatment of mental illness, right, to our mental health system, to child welfare, to protect, a police department. Every function of government is there in the budget.
Sure. Now, you're reminding me that Governor Shumlin kicked off the session devoting a State of the State address to opiate addiction, mm-hmm, which is kind of rare for mm-hmm, a sort of bully pulpit focus, mm-hmm, that strongly. Did that end up in new treatment, new spending? How does that shake out for appropriations on the other end of the session? Is there new spending on treatment in his budget, into the House budget? How did that shake out?
Yes, there is spending. What we were able to do is look at healthcare costs in total for people who have had substance abuse problems, and with the better management of care, we were able to identify savings, and what we've done is reinvest those other related healthcare savings to support expanded treatment.
Okay.
And the state's had an initiative called Blueprint for Health, and it's really how we deliver care and manage care for people with chronic illness. In my mind, substance abuse is a chronic illness.
Sure.
I mean, it's something people are going to have to manage and support their recovery throughout the rest of their lives. And so we're really looking at how treatment looks today. That's changed dramatically. A lot of care now is in a primary care office. And there's medication that is prescribed, buprenorphine or Suboxone it's called, and how we provide the support to that patient. So it's not in the same way that we used to think of it. It's the care has been more normalized.
Okay.
There's certainly the need for residential treatment along that spectrum, and then funding for recovery, which is to support people to stay clean and sober.
Right. And the residential piece would be the most expensive by
It
far.
is, it is, yes. But just like any area of healthcare, sometimes the needs of the individual require that level of intensive intervention
Sure.
and treatment.
Sure. And it's also part of a larger move that the governor is making to get issues of addiction not dealt with through the criminal
Yes.
justice system, but it's
Yes.
medical, file under medical.
That's right, and that's really what we're talking about, is how you create that continuum of services within that medical and community-based structure. And that obviously is a challenge, because certainly the citing of methadone clinics has not been without some bumps in the road, and that's part of the treatment. I in my district, because I have part of Orange County, actually there is a residential treatment facility in Bradford and Valley Vista, and then there's Maple Leaf, and then there's Serenity House in Rutland. And believe it or not, those facilities have been there for a number of years, and they're very much a part of the community and accepted by the community.
Great, great. So there's the budget. How about if we look at some of the standalone bills that are moving now and see how they'll impact spending. And it seems that the state can pass laws that will tell the private sector to do something. So raise the smoking age, and it won't cost the state anything. You can just say to the private sector, do this, and that's that usually. But there's the GMO bill has passed and been signed by the governor. That's right. It
went through the House. I don't know if the governor signed it yet, but he's indicated he will.
Okay. That's a case where the state is telling the private sector to do something, but it will have appropriations implications, because there's kind of this sort of a lawsuit fund. It probably has an official name, but there's a tucked-in $1 million. Is that an appropriation, or is that something different?
No, that bill came to appropriations because it did have an impact on the spending of the state. So any bill that has an impact would come to appropriations. And that did. And the reason it came is we created, any time a special fund is created, it comes to the Appropriations Committee. And in the course of deliberating this labeling requirement for GMO, related to GMO, the industry, like Monsanto, the message has been, if you have a labeling requirement go into effect, we're going to sue you.
Right.
And so it seemed to be fiscally prudent to anticipate the cost of that litigation. And what this is it's a constitutional issue, because it's freedom of speech or restriction of speech. And that's and with a constitutional related case, if the state loses, we not only have our own legal costs to pay, but we have to compensate the manufacturer or whoever brought the suit, their legal fees as well. And that's
Right.
what happened with when we had the BST, you remember, with milk.
Right, bovine.
Yeah, so they've worked very hard to structure the requirement. They've looked at past court decisions and which ones seem to be those that would support the labeling requirement. And so we've done everything we can to frame a law that creates that pathway to constitutionality, but there's still that risk. So we created a fund. We identified how we would put money into the fund. We also anticipated that there would be contributions. Many people said, we want to have this labeling. We're willing to help contribute to the cost of litigation.
Private individuals have already on record saying we'll throw
and
money.
so that's why that fund was created. And I have to tell you, it's interesting. I think polls showed 2/3 of Vermonters support. It gets into, I want to know what's in my food. Mm-hmm. So it really came down to, do we want to have a law that gives consumers the assurances that they feel they deserve around what they're eating.
Right, right. And that seems to be across the political spectrum. People
Yes.
are.
Yes.
I mean,
Yes.
that
It was
basic
very
idea.
bipartisan. And it passed the Senate on a vote of 28-2. So it was very, very strong support. And the bigger concern is if recognizing that we were going to be litigated and how we position ourselves
Sure.
to anticipate that.
Now, it's a freedom of speech issue because the state is telling an entity that they sort of have to say something. It's sort of
right.
forced speech,
Yeah,
I guess.
yes.
There's probably a whole area
Yes,
of
it
law
gets,
about
yeah.
that.
That's what, I was not part of that. I'm not on judiciary,
Right.
but, they looked at all the legal aspects of this and, as I say, tried to craft the law in such a way that it had the highest likelihood of being successful if litigated.
Okay. So does that mean Monsanto could go right to federal court and could bypass the whole state apparatus because it's a constitutional issue, or are they going to have to walk through the state? That's ask judiciary.
Yeah, I have to ask judiciary where they would bring the lawsuit.
Yeah. Okay. But those are the big guns, so they may be able to just jump right to the federal. And there's $1 million. Is that it? Right?
It was $1.5 million.
Okay.
We were anticipating recoveries into the Attorney General's office, and we just reserved those. And then, as I said, allowed the possibility for other people to make contributions.
Right. What's amazing is it seemed like such an experimental, genetically modified organisms. I remember hearing first about it maybe 10 years ago. And now it's like in 80% of processed food. It just went boom.
A lot of it's in corn. And there's no question, but and around here a lot of the corn is grown for dairy farms. So it's not if the animal consumes it, it's really the food product that's being consumed by the individual.
Right. And I'm hearing the argument that well, there already is labeling because products that don't have GMOs in it say GMO free. So does that mean the consumer would now have to assume that everything that doesn't say GMO free has GMOs? It looks like the state is making a stand and saying, no, that makes no sense.
Yeah, the consumer has a right to know.
Right.
Yeah.
Right.
And interestingly, I've seen seed catalogs that will say, GMO seeds. So you're right. There are people that say it's good marketing to make it very clear.
Right.
And that was part of the argument. Well, maybe you should just exploit that section and by saying we're GMO free. But
Sure.
that all got weighed out, and ultimately the general sentiment was, we want to know.
Please, tell me what I'm buying. Just got a quick minute. The other big piece, minimum wage bill, will have budget implications. Are there any state workers or vendors that are below the minimum wage?
No.
Do you see that having impact? Or?
No, in terms of the state workforce, no, not our hourly wages are above that for state employees. Where I see a connection would be, for example, in our mental health agencies where they're hiring a lot of direct care attendants for people with developmental disabilities or with home care, where that wage rate could impact. A lot depends. There's many different ideas about how to proceed over a multi-year period of time, a single year, and
right.
And I can't predict at this point how that's going to.
That's actually not figured out. There's sort of some graduated over the years.
Yes, Senate Economic Development has come up with a multi-year proposal. The House wanted to do it all in 1 year.
Okay, and your goal is to have the Senate's version of the bill out very soon.
Yes, tonight.
Excellent.
We will not leave without it.
Okay, so we got to get you out of here so you can get back to work. Thanks so much for the time. And then the Senate and the House will have to do some reconciling, most likely.
Committee of Conference, and we'll work out the differences, and that's what gets voted on and becomes a budget.
Oh, so thanks so much for your hard work. That sounds like rather difficult, and I appreciate it.
Well, thank you.
All right. Night, everyone.